That has been the Democratic strategy for 30 years, maybe, and it has failed to deliver for the people we care about most, the undocumented Americans that are in this country.
Yeah, that's why they didn't stand during the State of the Union. Remember that? Connecticut Senator right there, Chris Murphy, saying the left cares the most about undocumented Americans. It is something Texas Congresswoman Beth Van Duyne pointed out yesterday. Listen.
When Democrats tell you what they think, believe them. When they tell you what they are going to do, believe them. This is the party of defunding police. This is the party of defunding ICE.
And we are pleased to bring in right now Congresswoman of Texas, Beth Van Duyne. She's also the chairwoman of the Subcommittee on Economic Growth, Tax, and Capital Access, a member of the very important Ways and Means Small Business Committees. Great to see you, Congresswoman. We also heard from the president during the cabinet meeting today saying that they are a party in chaos. I don't even worry about the Democrats anymore, he says. And I think it is comments like this that Americans are wisened up to.
Yeah, no, it's absolutely true. Again, when Democrats tell you that they're going to tax you, believe them. When they tell you that they are going to prioritize illegal immigrants over U.S. citizens, believe them. And we're seeing it play out. We're seeing it play out right now in the Senate. We have a bill that we have passed. We've done our job in the House. We've sent it over to the Senate to fund Homeland Security. At a time when you're seeing what's going on in Iran, Venezuela, Mexico, we need our Coast Guard funded. We need FEMA funded. We need our TSA agents funded. We have sent over funding mechanisms, but they are holding that hostage, holding the American traveler hostage because they are prioritizing illegal immigrants and they want to defund ICE. We're going to continue to fight it. I'm not sure the conversations that they've had in the Senate. It sounds like they just keep moving the bar. They say we'll do this, and when we meet them there, they keep moving it. So we'll see.
We just saw Senator Kennedy is going to hold a vote. So obviously, at least getting Democrats on the record is instrumental as well to show exactly what they're not willing to do. I want to play a little bit of Alabama Senator Katie Britt, who says there's an easy way to get both parties to the table and come up with a funding agreement. Here's what she says.
If the men and women in this building, if members of Congress, House or Senate weren't getting a paycheck right now, they'd be much more eager to come to the table and to have a conversation and to figure out a pathway forward.
So this is what she's saying. I mean, Congresswoman, is that something you would agree to, giving up your pay to incentivize a deal to get done?
I think it helps people who are here who are wealthy. We definitely have our wealthy members of Congress. We have our poor members of Congress. But if that would move the needle, I'm all for it. I don't think it's fair that we as federal employees should get paid if other federal employees are not getting paid. That said, if you're going to be a voting member in this House and you're voting not to pay them, maybe we should discriminate. And those people who vote against opening up the government have their paychecks stopped. Again, TSA is doing God's work right now, and I have been traveling a ton over the last several weeks, and these people are dealing with stress. If you are in Houston, you're waiting in 4-hour lines. In Atlanta, be nice to your TSA agents. They are working and they are not getting a paycheck right now.
Yeah, well, we did see Delta is stopping some of the congressional escorts. So members of Congress in some Delta checkpoints won't have to get their escorts. So maybe that also will give some incentive, I guess. I want to talk about the Outpatient Surgery Access Act, which you introduced. It's aiming to modernize Medicare payments for ambulatory surgical centers. Tell us the importance of this, especially for seniors, Congresswoman.
Well, we find that seniors don't always do well in hospital, and when they can go out to outpatient surgery centers that are specifically set up for helping them get rehabilitated and keep them out of the hospital, they do better. It's also a lot less expensive than having them in these hospitals. So again, we put all these regulations in our healthcare systems, and then we are concerned why and question why costs are rising. It's pretty obvious why they're rising. So this is a common sense, no nonsense bill that basically says we're going to strip some of the regulations, and we're going to allow, mainly seniors to get access where they need it best and to get the best care for a much cheaper price by just stripping some of the regulations. So I am introducing this with Representative John Larson, and again, it's a bipartisan bill. Let's hope that we can get support for it. Our seniors deserve that.
Well, cost effective, but also better for the patient. And that's really what it's about. Congresswoman Beth Van Duyne, good to have you with us today. And obviously, we'll watch the vote that's happening right now over in the Senate. Thank you.